Let's get into a segment that we enjoy week in and week out because we walk away from this having learned something. We've made a new friend, and it works. Sometimes no one's hung up on us yet. I hope Dr. Lamont isn't the first one who does so. Well, we're going to continue on with What's Up, Doc, where we spend some time with the experts at Mercy Health. Our guest this morning is Dr. Sarah Lamont. We're going to talk a little bit about orthopedic hand surgery. Dr. Lamont, good morning to you.
Good morning. Thank you for having me.
We are thrilled to have you, and thanks for agreeing, or you got forced into it, or you drew the short straw, or you lost a bet, or whatever it was that got you here. We're glad you're here.
Great, me too.
I don't know what Christina has over you, but thanks for joining us.
Yeah, that's right. Tell us a little bit about you.
Yeah, so I grew up in Wausau, Wisconsin, moved here to Rockford, and loving it so far.
Did you move here after you became a doctor or before?
Yes, after. Yeah,
Oh, okay.
I went to UW-Madison for medical school, and then I did my residency in Ohio, and then I did a subspecialty fellowship in hand surgery out in Virginia. So now I'm back.
So a badger for your medical degree. We always like to find out. Me especially. Well, Riles doesn't care as much as me, but we want to find out where you did your undergrad to find out if we do really like you or not.
Yeah, Joe's got this college thing.
Yeah.
My undergrad was UW-La Crosse.
Oh, that's fine. That's fine.
Does she pass?
Yeah,
She's
that's fine. That's fine.
Okay.
I'm good at this. I'm drawing a blank. What's the mascot of UW-La Crosse?
An eagle.
The Eagles. All right. Mm-hmm. I apologize. I should have studied for that.
Well, yeah, you're the one asking the questions here. Just remember that. All right.
Yeah.
When did you know you wanted to get into medicine?
So I actually tore my ACL downhill ski racing in high school, and after that surgery, I knew I had to get into it. So, yeah.
Really? That impressed with the quality of care you got? That fascinated by the entire topic and looking at what the inside of your knee looked like and all those things?
Oh yeah, and I'm back to running. I'm doing a marathon this fall, so orthopedics is really a great specialty that gets people back to the level they were at, and that's always my goal with patients as well.
Well, when you think about that knee thing of yours, you go back 30, 40 years, somebody suffers a similar incident like that. The future going forward would not have been as bright as yours, I wouldn't think.
Right, exactly.
So
there's been a lot of advances for sure in medicine.
So we're here to talk about hands specifically. How did you?
Yeah, I don't do knees anymore. So.
Yeah. Oh, so did you start with knees and then did you graduate to the hand?
I did. My residency was 5 years in orthopedic surgery, so I did all of that. And then now I just specialize in the hand.
Is there a hierarchy? I mean, do you hand doctors look down on the knee doctors, or is it the other way around?
And then they glare at the foot doctors?
No, we are all best friends.
Oh,
of course not.
Okay, all right.
Yeah, you just picture this podiatrist in there yelling at her. It's very tense. No, it doesn't sound like it is.
The feet are more important. No, okay.
All right, as far as hand surgery goes, what are the kinds of hand issues that you deal with?
So a wide variety, really common everyday issues like carpal tunnel syndrome, or where you have numbness and tingling in your hands. I also treat arthritis, broken bones. So if someone gets in a car accident, I'm going to be there to help fix that and get them back.
One of the questions I'm very interested in is does the handedness of a person determine what gets injured more often? If I'm right-handed, am I going to hurt? Are you seeing more procedure on the right hand because they use it more?
I guess if you're, a machinist and that's something that gets injured, maybe you're more likely to. But no, there's really, I see left and right hands all the time.
Okay, good.
All right. So dominance does not really play an overall factor in it unless it's a one-handed job and you hurt that hand.
Yeah.
Okay, that makes sense. Now, carpal tunnel is something we hear often, and a lot of people will draw the picture in their head of someone with their hands over a keyboard, fingers flying furiously across the keyboard. They are doing this day in and day out till one day, oh my Lord, this is the worst pain I've ever felt. There's other ways of getting carpal tunnel, aren't there?
Yes, so it actually is genetic as well, and just certain conditions that patients have, like diabetes or high blood pressure, can also contribute to it.
As people become far more attached to their phones, are you seeing any particular injuries having to do with how people are holding their phones? Like I've seen.
I do think.
You do?
Yes, I think there's more stress on the thumb. So maybe it does aggravate people that have underlying like thumb arthritis. Also, the elbow, you have a nerve that runs there as well. So some people are getting more and more numbness and tingling from that nerve, which is a cubital tunnel syndrome, and I do that surgery as well.
Yeah, there has to be something going on because the way you see, nothing is quite as repetitive as, I've got a daughter in her 20s and, seeing that phone literally spot welded to the hand, I've got to believe at times, you got to be putting a little stress on some part of that hand, the way it's flying around on that little keyboard.
Oh, yeah. Mm-hmm.
So I want you to confirm an urban legend for me, too. I saw on the internet that people's pinkies are becoming farther spaced away from their hand, just because that's where phones rest all the time on their hands, and it's kind of.
I have not heard that.
Okay.
I don't know if there's some new studies coming out about it, but not to my knowledge.
All right, debunked. Yeah, it's debunked right here on the show. Right here in the show. If you're just joining us, we're spending some time with Dr. Sarah Lamont. We're talking hand surgery. She's with Mercy Health. There are obviously more options than just surgery if you're having difficulties in that area, right?
Yes. I always want my patients to try conservative options first. Anti-inflammatories, braces, I do injections. I also work very closely with our hand therapists here at Mercy. They have extra training that allows them to just focus on the hand, and I really have seen some patients make great gains from working with them.
I'm sitting at my desk. We like talking to you. I would like to meet you sometime, but I don't want to see you in your office because I want to take care of my hands. What is there anything I can do at my desk while I'm just reading something, mindlessly doing with my hands to keep them healthier and stay out of your office?
I'm always working on grip strength, so some of those tennis balls, things like that, are good tools to have. Just keep your hands strong, and then doing good office ergonomics, having, everything so you're not having your wrist, bent at a funny angle, things like that can just put extra stress on your nerves that doesn't need to happen.
And when we talk about hand surgery isn't relegated simply to the hand, though. Do you go, from the fingertip to up to the elbow?
Yeah.
Because at one time, a number of years ago, I got a diagnosis of tennis elbow.
Yes.
And that was outstandingly painful. And really, I felt as though I'd been shorted because I wasn't playing any tennis.
Tough.
I hadn't played tennis since I was in high school, so it couldn't be that. And I remember going in and to have it taken care of, I got a shot in that region.
Yeah, that's actually not recommended anymore.
Thank God. I got to tell you, Dr. Lamont, that was the most agonizing shot I have ever had in my life. I wanted to punch everyone in the room. And because they didn't even, that butcher paper that you guys put across the bench there, they had me lay my arm down on that. I shredded all that paper. I had all of it was in a ball in my fist. And the doctor himself, who stood back and laughed, he goes, "You look murderous." I'm like, I was feeling it that was excruciating. But I got to tell you, 10 minutes later, it was gone.
Yeah, I'm
glad they don't do it anymore. I'm glad there's other ways.
Feel better. But if you look at patients, if you take two groups, patients who don't get injections and patients who do at a year, there's no difference between them.
Damn it.
The course of tennis elbow will just 9 out of 10 times resolve itself at a year.
Oh, now I'm sorry I didn't. Sorry, I didn't punch everyone in the room. Now I didn't know I could have just waited that one out.
Right, Rose, you mentioned you never played tennis, but you picked up tennis elbow. If in the tennis elbow cases you see now, I'm guessing most of them aren't caused by tennis anymore. Would we give it a new name if we diagnosed it today?
It's just called lateral epicondylitis. That's the main term. You can see it in weightlifters too. Just even some surgeons get it. Overuse is a problem.
Yeah, it was painful and not to where I couldn't sleep at night, but it was really uncomfortable.
I forgot the science word you use for it, doctor, but I will start calling it surgeon's elbow from now on.
No.
Well, especially if you get diagnosed with it, then it's going to be surgeon's elbow. Oh, are you a surgeon?
No.
No, I'm not.
Don't call it that.
Dr. Lamont, how do they know when it's time to seek help from someone like you, an orthopedic surgeon? When should that light bulb click on?
Well, definitely if your primary care physician recommends it. They are amazing people that see the ins and outs of hand surgery complaints as well. So they are, keeping an eye out for people who need to see an orthopedic surgeon. Also, if you've had family members that have been treated by one, and it sounds like you have the same problem. Again, some of these conditions are genetic, so just kind of pay attention to how you're feeling, and once it's becoming an everyday problem, then it's time to see someone.
All right, I got one more for you. I hope you don't make me change my ways right now. But I'm a compulsive knuckle cracker. How bad is that for me? And when should I be getting arthritis?
So that
he'd like an exact date on that.
No, you can do that. It's not going to change anything.
Oh man! Once again, wish my grandmother was here.
When do doctors give you just great news like that all the time?
I don't know.
That's wonderful.
That's not the stuff that I heard growing up. I remember my grandmother literally smacking me across the back of the hand when I cracked knuckles one time, as if, slapping me in the hand was much better than me cracking the knuckles.
Fine.
But you'll have arthritis later. You mark my words on that one.
All right, we're good to go.
Yeah.
Keep cracking.
Now, apparently you will not. Dr. Lamont.
If Grandma has arthritis, you might be getting arthritis, though, because of the genes.
Because she cracked her knuckles.
You can thank Grandma for your arthritis.
Yeah, thanks, Grandma. I really appreciate that. Dr. Lamont, for people who tuned in this morning and thinking, I should have this looked at, what's the best way to get in touch with you?
Yeah, just call our office. I'm at the Rockton location for clinic, and then I also do my surgeries over on Riverside at Javon Bay, the new hospital.
Outstanding. Is there anything about hand surgery, orthopedic surgery, and all that we didn't ask you that you really think people ought to know?
No, I think we covered a lot of it, but yeah,
we're pretty good, aren't we?
You're wanting to get, I'm there to be, the team approach to get you a solution, whether it's golf or gardening. I'm sure we can get you back to the things that you love doing.
Outstanding. Dr. Lamont, we really appreciate you taking time out of your busy day for us. Have a great rest of the week, and thanks again. There's Dr. Sarah Lamont with Mercy Health.